Our schools partner with parents to ensure that a child's academic, social, and emotional needs are met. And to that end, we are thrilled to have you joining us for tonight's important workshop with Leanne and ETL Foreman and Sharon Derrick from CCSA. Leanne and ETL Foreman are the founders of CCSA, and their mission is to eliminate the stigma around addiction in Jewish communities. Through our program tonight and others like it, they're working with students, parents, and educators to address these issues. Sharon Derrick is the Associate Director of CCSA, and she brings a wealth of experience from the addiction world to us. She'll be guiding us through tonight's program to give strategies, provide support, and hear from you on how we can help our young adults. For additional information, please see the chat for their complete bios, as well as a link to CCSA's website. Before we begin, I'd like to go over a little bit of Zoom housekeeping. You've all been muted so that we don't have any ambient noise, but please feel free to submit any questions in the chat box to Avi Siegel, our Director of Teen Initiatives, who will be facilitating tonight's Q&A. In addition, closed captioning is available. Please forgive any technical difficulties we might encounter during the program. And finally, please note that tonight's session is being recorded. And with that, I will now turn it over to Leanne and ETL.
Thank you so much, and thank you everyone for joining us this evening. One request, if you are able and you are in a place where you're able to turn your cameras on, it makes it a much more interactive, communicative experience for us. So if you are able, we would greatly appreciate it. If you're not, we of course understand. What we like to accomplish with you over the next 40 minutes or so, because we want to make sure we leave ample time for Q&A. Q&A is far and away the most important part of this evening. So we do encourage you, please do get those questions into the chat. What we want to accomplish is talk to you a little bit about our family's journey through addiction and recovery, why we think that is relevant to you as parents of high schoolers. Sharon is then going to take you through some of the things we're seeing, drug trends that are out there, and communication skills to talk to your children about this very important issue. Leanne is going to talk to you about what we're seeing and hearing when we go into schools around the country, what's on the minds of our teenagers around this issue. And then we'll wrap it up with a couple of minutes on stigma, why it's so important to be eliminating stigma around this issue. So I'll jump right in. Our daughter, Ilana, is the second oldest of our 5 children. Ilana's journey through addiction and recovery began the summer before 9th grade. Now, you're all high school parents. You all remember how incredibly stressful that transitionary summer is between middle school and high school. And for Ilana, that was certainly the case. She was incredibly anxious about starting high school. One summer night towards the end of that summer, Leanne and I were taking advantage of a slow evening, decided to go out to eat on a date night. And we came back and we found Ilana drunk. We were quite shocked. We'd never seen her touch a drop of alcohol. We didn't have a lot of alcohol in the house. In fact, Ilana found a bottle of whiskey I had gotten as a gift from a work colleague. Leanne had some vodka that she would use for cooking. We had wine in the house, and Ilana basically found whatever she could find, poured it all into one big cup, and downed it. Ultimately got very sick, and thank God not sicker than she was. But what she told us afterwards is that before she got sick from the alcohol, she was kind of thinking to herself, how am I going to deal with this anxiety? And her frame of reference was TV and movies. And what she recalled is that in TV and movies, whenever somebody was anxious or nervous about something, they would take a drink and it would calm them down. And so she decided, worth a shot, no pun intended. So she found this alcohol down the hatch. And what she remembers before getting sick is looking in the mirror and saying, this is it. This is how this is what makes me feel better. This is how I'm going to get through life. Because it worked. The alcohol, in fact, calmed her down. And so then she got really sick. We came home and of course we said, look, let's get you to bed. We'll talk about this in the morning. And, being responsible parents, of course, we took her to a therapist to try and dig into what was going on there. We were very attentive to her anxiety. And from our perspective, at that point, this was a blip. It was a one and done. Because honestly, from our perspective, throughout high school, she was functioning incredibly well. She was an honor student. She was the captain of her school soccer team. She founded the school's chess team. She had friends. She was popular. Everything looked just like you would hope it would look for her in high school. What we didn't know, and what we came to learn later on, is that all through high school, she was continuing to experiment with alcohol and then subsequently marijuana. Her access to these substances very often was through a friend, a family we knew, a place that she would go, on a Saturday afternoon and spend Shabbat afternoon with them. And this friend had an older sibling who would supply his little brother and her friend with alcohol and marijuana. And so throughout high school, she continued to experiment. No, not steady use. She wasn't using every day. She wasn't even necessarily using every week. But what was happening was her brain was starting to become accustomed to the fact that this is what would, it was use of these substances that would actually calm her down and that would relieve her anxieties. As she moved on and got to college, she had access to much more dangerous substances. And what she described to us in college at various times when she started to experiment with and use these more dangerous substances, but there was a battle between her heart and her brain. She really wanted to stop, but her brain was becoming so dependent on these substances to just function that she was just unable to. And she told us that there were times when she would just take everything she had, flush it down the toilet, say, "That's it, I'm done. And I'm going to stop for 30 days. And then 3 days later, there she was buying more drugs and using again. And of course, we were blissfully unaware that all this was happening. One night, it was Ilana's birthday, and we were taking her out to eat. A lot of our lives are centered around restaurants, as you can see. And we took her out to one of her favorite restaurants in New York City, and we're having dinner with her over her birthday. And kind of in the middle of a conversation, she kind of blurts out to us and says, "Ima, Abba, I have a problem with drugs." And I have to tell you that I don't remember much more about that conversation because my head started spinning. These are words you never expect to hear to come out of your child's mouth. I think we said all the right things. I think we told her, "We're here to support you. We're here to help you get the help you need." And I think we were compassionate, but honestly, I don't really remember. Of course, just a few days later, she recanted and said, "No, don't worry about this. I've got this under control. I'm going to manage things." But the reality was she couldn't manage it. This honor student in high school was not going to class. She was starting to fail her classes. She was unable to function without the use of substances. And finally, it got to a head where we told her, "Ilana, we can no longer support you continuing in college. We can no longer pay your rent for your apartment. We can no longer pay your tuition because it's just not healthy for you to continue." And we got her an appointment with a therapy practice that specializes in helping young people find appropriate places to get treatment. And to her credit, she kept that appointment because it had to come from her. And we got a call one Saturday night from her saying, "I'm on the tarmac. I'm headed down to Florida. I'm going to a rehab center and I'll be in touch when I get down there." Now, rehab for Ilana in Florida, as it is unfortunately for a lot of people who suffer from substance misuse and addiction, was not a straight line. There were lots of ups and downs. There was one period of time where a friend of Ilana's, who she met in treatment, he's friend in air quotes, convinced her to leave the treatment center, said, "This isn't working, let's get out of here." And they left treatment, and for 3 days, we didn't hear from Ilana. She told us afterwards she wasn't sure if she sold her phone, lost her phone, or doesn't really remember much about those 3 days. Maybe she's sparing us the details, but for 3 days, we didn't know if she was alive or dead. We didn't know whether the next call was going to come from hospital, police, or the coroner. Thankfully, the next call came from another treatment center that was checking out her insurance. She was ready to check back into treatment. Fast forward a few weeks later, that same friend turns to her and said, "You know what? This isn't working, Ilana. Let's get out of here again." And to her credit, Ilana said, "No, I want to stick it out this time. I want to see this through." Just a few short months later, that friend of hers overdosed and died. And so we often reflect on the fact of how tenuous life is for those who suffer from this disease and how close we were to losing our daughter. In fact, it was really just a few months ago that we learned of her overdose while she was in treatment, in fact, and how close she came to dying. Had she overdosed in a place other than where she did, there's a very good chance our story would have had a very, very different ending. We as a family didn't really know much about this. We didn't have a frame of reference around addiction. We had to relearn or learn all about this disease and how to relate to it as a family. And I remember there was one very impactful Sunday morning. We were at our local Dunkin' Donuts, and the rabbi of our shul was there. And he knew a little bit of what was going on. And he turned to us and he said, how are things going with Ilana? And Leanne, who has a tendency to be just a little bit sarcastic from time to time, turned to him and said, Rabbi, we must be the only people in all of Bergen County dealing with this issue because nobody talks about it. And he kind of, sadly laughed and said, if you only knew. And that's when we realized that as alone as we felt as a family dealing with this issue, there were so many people suffering silently, so many families suffering silently beside us that we didn't even know. And so we set out to try and do something about that, to try and create an environment where no family would have to suffer alone and deal with this issue alone the way that we did. We worked with some professionals and a local rabbi in the community to organize an awareness event. We wanted to bring light to this issue in our community. Leanne's mantra was go big or go home. We weren't going to do this halfway. We went to the local press. Our story was on the front page of the Bergen Record. It was in all of the, in the Jewish Link and the Jewish Standard and all the other, the Jewish papers. And we organized this awareness event for a Sunday evening for those of you who might know, at TABC and TNEC. The room there seats about 500, 600 if you really squeeze people in. Just for fun, we set it up for 450. I think, honestly, I felt there would be about 50 people just trying to see what's going on out of morbid curiosity. We had a local clinician who spoke, local rabbi spoke, someone in recovery spoke, and then I spoke as from the perspective of a parent. That night, 800 people showed up to watch our event. Another 250 watched online. It was clear to us that we had struck a nerve and that this was an issue that our community was clamoring for more on. We had the foresight to put feedback cards out that night to ask people what they wanted around this issue going forward. And there were 3 themes that came back very clearly that evening on those feedback cards. Number one, people wanted more awareness events. They wanted to learn more about this issue. And so we've been running awareness events in person over COVID. We've run them online on Zoom, and we're continuing to do those periodically. The second thing was people wanted a support group for loved ones of those suffering. That support group was started in the summer of 2018. Sadly, it is running strongly to this day. Sharon is one of our facilitators of that group. Now that we went on Zoom, when COVID hit, we actually have people from all over the country joining us. And again, just sadly, very well attended support group. And then the third thing, what really came through on most of the support, most of the feedback cards, was that the community wanted the schools to be doing more about this issue and to be addressing this issue. And so we set out to create school programming for students, for faculty, and for parents around substance use prevention and education. Since 2019, when we started presenting in schools, we've now presented in over 50 schools. Those are middle schools and day schools, grades 6 through 12. We presented to we're going to crack 10,000 students sometime in the next few weeks, and thousands of parents. So it is clear that this is a real need of our community that is being met. With that, I'm going to turn it over to Sharon, who can talk to you again about some of the trends we're seeing and some communication skills that you can use in talking to your children about this issue.
Great. Thank you, ETL. Hi, everyone. Good evening. So great to be on and to partner together. I always start with once you hear the foreman's story and what they went through, it's very moving. But what's like incredible about their story is that their daughter survived and they're able to share their story. And many times what we see is that doesn't happen. Unfortunately, we lose many Jewish young people through addiction, through an overdose, through just making a bad choice, not even necessarily about addiction, but just a bad choice that they've made. And so it's so important for us like tonight to be able to really start these conversations, to start talking with our children, how to communicate with them, and to kind of try, even if it's a comfortable or uncomfortable conversation, to be able to do that. So I hope tonight we give you the tools in doing that. I'm going to share with you my slides and talk you through a presentation, and then I'll hand it back to Leanne. Just okay, so let's just start at the beginning of Addiction is when a person has the inability to stop consuming a chemical, a drug, a substance, or perform an activity. Here in this diagram, you can see how the brain changes and how it can lead to addiction. So let's look at different types of addictions. These are really common ones we're seeing with teenagers. We're looking at nicotine, gambling, sex, pornography, alcohol, drugs, eating disorders, and electronics and social media. These are the most common ones. Sometimes you might see a crossover, co-occurrence. You might see alcohol with nicotine, or you might see eating disorder with electronics. There's no one specific way. Sometimes it can cross over with any one of these. Let's look at what type of substances your child might come across. Again, these are popular ones that we're seeing: e-cigarettes with nicotine in it, the marijuana weed pens, prescription medications, which it could be a prescribed medication that is given to them, being used, misused, and then alcohol is very easy and accessible to our children. So let's look at some of the facts here. Alcohol is the most widely used substance. Many times we're seeing our kids binge drinking, which means drinking excessive amounts in a short period of time. Stimulants are also popular. For teens that have a prescribed medication that is stimulant, such as Adderall, Vyvanse, can easily be misused by sharing with friends, using someone else's prescription, or taking a higher dosage than prescribed. Marijuana is now legalized in New Jersey, and for some teens, it is more easily accessible and is perceived as less dangerous. And just to keep in mind, the marijuana you once might have smoked is not the same as today. It has higher THC levels in it. Vaping and e-cigarettes is, again, another one that's very popular among our teens. A single pod contains as much nicotine as a pack of cigarettes, which equals to 200 cigarettes puffs. Let's look at the long-term effects. Become physically dependent, addicted, memory and learning problems, health issues such as increased heart rate, lung problems, blood pressure, mental health issues such as anxiety, panic, aggression, paranoia. I just want to look at different methods of consuming cannabis. We're looking at four main areas. We're looking at sublingual, when it could be under the tongue, like a spray or drops. It could be inhalation, where they could be using a bong or a vape. Topical, where you're rubbing cream into your skin, or ingestion, where you could eat like a cookie or brownie, or taking a pill. The two most popular ones we're hearing, the teens are telling, our teens are telling us is inhalation and ingestion. So let's look at these edible products that are out there. One is very scary because they look so alike, and it can be easily mistaken. And again, you know, edibles and all of these products are meant to be sold to children or people over the age of 21. But as you can see here, it's really being targeted to a younger age. And so it's just important to look to see how it can, one, is easily missed. And you can see here which products, as you can see all the circles around here, what is delta-8, or it might have THC on it. And just to be able to see the subtle difference, or you could see like Haribo, Baribo. It just shows you the difference there. And again, just these are some other local products that we're seeing from a Jewish dealer in Brooklyn is making their own products, and it's making it across into different communities. And as you can see here, some of the products have kasher lepesach on here. And again, it just shows you how it can come in honey, lollipops, chocolate, popcorn. So I just want to move into talking about e-cigarettes and vapes here. We've seen here that there's more than 2.5 million high school and middle school students currently use e-cigarettes. And when you look at this image, you see that they're bright, they're colorful, they're small, they're disposable, so you can buy it quickly, use it, and dispose of it really quickly. And really the most popular ones we're seeing right now is like the View, the Puff, Miley, the popular brands. I just want to move into fentanyl, which is what we're seeing recent trends right now. The fentanyl is coming across in many substances. Fentanyl is a synthetic opioid that is significantly more potent than heroin and far more deadly. It is often added to heroin or other street drugs, which is increasing the risk of overdose. I want to just go into a campaign that's out there. They're calling it the One Pill Can't Kill campaign, and fentanyl is also made in a rainbow of colors here that you can see that looks like candy. And also fentanyl is being pressed or added into fake pills, and it can just be very, again, mistaken. It can be missing. People don't necessarily know how it's coming, and if it's coming from a dealer, you don't necessarily know that fentanyl is in it. So let's look at signs and symptoms of substance use. First of all, I just want to kind of start with that this is not meaning my child is an addict. If you see many things you check off personally on the list and you think, oh my gosh, this could be my child, doesn't mean they have an addiction problem. It just means something is not right and we shouldn't ignore it or sweep it under the rug and say I'll deal with it later. These are just signs for you to be aware of, and if something could be wrong with our children. So let's look at behavioral, like if you're seeing the change of relationships, they once were an outgoing child, now they're being withdrawn, they're being quiet, they're hiding out in their room instead of being more with the family like they used to. Those kind of things are, again, concerning signs. If you're looking at physical, if they don't care about their appearance anymore, they're not being their cleanliness, those kind of things, then again, when you see that happening, you don't want to ignore it. You kind of want to start the conversation and say, okay, what is going on with my child? Let me check in with them and see what's happening, what's going on. So let's look at contributing factors. Why is this happening? So let's start with the most popular ones that we're seeing. It's peer pressure. They're in high school, they're in a new crowd of, they have a new crowd of friends, and it's being socially offered to them, whether it's at a party or hanging out in an evening. It's just there and it's accessible, and there's pressure around it. Then we're talking about trauma. It could be that they have gone through a divorce in their family, or they've had a car accident, or sometimes it's around abuse. So again, that's then self-medicating because they want to escape from the feelings that they're experiencing. Again, we're looking at mental health issues. It could be diagnosed mental health issues or not diagnosed, which could be associated with depression or anxiety, low self-esteem. So when we're looking at that, again, if someone is not feeling comfortable within themselves, they might want to turn to a substance to try and escape those feelings or to try and make themselves feel better. And prescription medications, which we see a little, not too much anymore, but it's still happening when someone's prescribed a medication for dental work or surgery if they broke their arm and they're given a prescription and it's not being supervised properly. That can also lead to, it can be a contributing factor towards addiction. So let's think about how can you help? Let's talk to our children. I think most important when we start these conversations to think about where you are at with this and the behavior you are modeling around substances, and just to think about it at a certain point, your kids are watching everything that you do, they're seeing it, and they're very aware. So let's start with having the real conversation, picking different ways to start this conversation. So first of all, let's look at a good time to talk. So a good time to talk would be, it could be when you're having dinner together, having a car ride, in a car ride, just making that time to be able to sit quietly and talk, not when a party or grandparents are about to come over and you're saying, okay, let's talk about this. We want you to keep an open mind, not making it about yourself, but to really make it about your children and what they're going through. Ask open-ended questions. Who did you hang out with last night? Where did you go? What movie did you watch? That allows you to start the conversation. Use active listening. So put down your phone and really focus in on your child when you're talking to them. Good eye contact, smiling, nodding head, just being present in the moment when you're talking to your child. Use I statements. I wanted to ask you, I was thinking. Offer empathy and support, right? You're there for your child. So again, don't make it about yourself. It's about what they're struggling with. And by that is being able to offer them help and guidance. We can't fix the problem anymore, but we can help guide them through it and discuss through what's going on. And the last one, staying calm and patient. I myself, it's hard as a parent. So but you have to just start thinking about that. Again, being able to take a deep breath in and out and stay present in the moment to discuss through what is happening. And if you're struggling to stay calm, then to maybe remove yourself from that moment and then consider coming back a few minutes later or an hour later to be able to have that conversation and really be patient while you're talking to your child. So let's look at risk factors and protective factors. So risk factors could be trauma, mental health concerns, lack of parental involvement. Then we're looking at the protective factors that really do weigh in when we are able to do this is parent or family engagement, being able to have these discussions with our children, having school programs, youth events, and really when we talk about the delay of age of first use. Let's talk about Jewish rituals and alcohol. What are the messages to our children? So first of all, we know that Jewish rituals is all about alcohol and we can't change that. But what we can do is have a healthy relationship around that. And that's what we want our children to see. And that's how And so it's important to think about when we talk about kiddush, or let's say on Friday night, we're bringing out this big bottle of wine, or this fancy bottle of wine, not big bottle necessarily, but a fancy bottle of wine. And we're talking about, okay, I'm making a big thing. I brought this $200, $100 bottle of wine, and making a big thing out of it, and making it the center of the table. Versus, okay, I'm pouring a bit of wine and then putting it to the side. The same thing goes with the whiskey. Anything like that, when we are making a big thing out of alcohol, it can, again, it's the messaging around it that we're showing our children how important this is. We're kind of glorifying it in that way. And so it's, again, we want to be able to show our children how to have those healthy relationships around it without saying, no, I can't have it. But we want them to demonstrate it by the way we act and behave. So let's talk about types of treatments out there. Again, many times people think, oh my gosh, I'm Jewish, I can't get help, or they can't go to treatment, they won't get certain foods, or whatever excuses come out. And really nowadays, we really want to kind of be able to share that it's okay, and that there's therapeutic services out there, whether it's inpatient, whether it's outpatient, whether it's group therapy. And as you can see, there's lots to be offered to someone who might need help in treatment. So with that, I'm going to just hand it over back to Leanne.
Thank you so much, Sharon. So what do we do in schools? We go in with a curriculum that builds on itself from year to year. We talk to 6th through 12th graders in middle and high schools, and we bring in what we call educational presenters, but they are actually Jewish people who themselves have firsthand lived experience with addiction. Most of them are in recovery themselves from struggles with substances. And not only do they tell their story, which is very impactful and very informative, but they also teach the science and the data behind addiction so that we can employ evidence-based best practices in terms of prevention education. The great thing about these presentations is the interaction we have with kids, that we open up dialogue with them, hear about their concerns, hear their questions. We have an exercise that we do in most of the programming, which is to hand out index cards, asking kids to ask questions anonymously. And from that, we really shape the content of our programming, proactively addressing a lot of things because we hear it over and over again from our children. So all of our presenters, the ones that are in recovery, and we have 12 presenters, we have 11 that are in recovery. All of them started using substances somewhere between the age of 11 and 14. So we know, even just from our anecdotal experience, that our children are using and that it can lead to addiction later in life. Statistically, kids are misusing substances as young as 12 and 13 across the country. That's a national statistic. And there's nothing to say that we are immune from that. We have to understand that we are a microcosm of greater society, and we have the same issues and the same challenges and the same hurdles to overcome. The other thing that we find out as parents is that kids know a lot more than we think. We are no longer, or probably never, really surprised at the questions that we get. I've had 8th graders tell me that heroin is really cheap and inexpensive. I've had, people ask about making meth, crack. I mean, these are not even substances that we necessarily mention in our programming. We talk specifically about nicotine, alcohol, and marijuana, which are the 3 most common substances used by our teens. But again, they know a lot more than we think. And the questions that we get are typically in what I call 3 main categories. The first is misinformation, where they might ask, younger children sometimes ask, isn't Advil a drug? So not even understanding the basic difference in an over-the-counter medication versus a prescription medication versus something that might be an illicit substance. The second question is, second category of questions are curiosity questions. Very often kids will say, what's the big deal? I really want to try it. What's so bad if I eat one gummy? I want to know how it feels. Is it really that bad to drink once in a while? And a lot of times almost an admission of use along with some other issues. So kids will say, I get really anxious when I go to party. I want to, not feel anxious, so I get high before I go and it helps me. So there's that, active use and active curiosity about using substances. The third category is concern, either concern for themselves. Many kids who will tell us, I'm vaping, I'm completely addicted to vapes, I don't know how to stop, or I'm drinking, or I'm getting high all the time, and I'm worried about myself, or I'm worried about a friend, or in some cases, I'm worried about a loved one, an adult in their life, whether it's a parent, a sibling, a relative. And a lot of these kids, and again, as young as 7th, 8th grade, are asking these questions, how can I help this person? And we have to talk about how it's not really their job to help them, but to understand what's going on in a way that it doesn't impact them negatively. Exposure is happening all around us. There's nothing we can do to stop our kids from being exposed to substances. If you walk around certain towns in New Jersey, and definitely if you go into the city, you're going to smell marijuana everywhere. They see it in their everyday lives. They see people vaping, they see it on TV, they see it on the media. The news is talking about the opioid epidemic and overdose rates. Alcohol, like Sharon mentioned, is in our everyday lives. We feel very strongly at CCSA that we are here to teach our kids how to safely deal with those encounters with substances, not if they happen, but when they happen. So we liken it to crossing the street, right? When you're teaching your child to cross the street safely, you don't take them out to the crosswalk when they're 15, 16 years old and say, look at the little man, look at the red light, look both ways. You're taking them out 4, 5, 6 years old, and you're teaching them how to get that across that crosswalk safely, because you know they're going to have to do it on their own one day. So same thing goes with substances. We're having these discussions with our children, and we encourage parents to have these discussions with your children. It's never too young. You could do it in an age appropriate, stage appropriate way. But again, because of the accessibility to substances, and I encourage you as high school parents, I've had this conversation. We have 5 kids, they're all post high school at this point. I ask all my kids, do you know where to get drugs? And the answer typically is no. And then the second follow-up question is, do you know who to ask if you want to get drugs? And the answer is yes. So they're one step removed, 1 degree removed from getting drugs. The perception of harm is way down with the legalization of marijuana. They think it's no big deal. The perception of harm about alcohol is down. Half the time with vapes, they don't even realize it has nicotine in it. They think it's just, flavored vapor. It's harmless. So we're trying to teach them the facts, not to scare them, because that doesn't work, but really to help them make informed, healthy choices. And as parents, like Sharon touched on those protective factors, being engaged with your children, trust me, like I said, I've had 5 teens. I've had 5 doors closed in my face. I've had 10 eyes rolled at me. You think your kids are not listening to you, but honestly, we are still the biggest influence in their lives, even through their teenage years, even when they're naturally separating from us and creating their own identities and differentiating from us. They're still hearing us. And it's important not to look at this as a one-time conversation, but to look at it as an ongoing process, to have those organic, teachable moments, to bring up the idea of your rules around substances, your expectations, to model those behaviors as we talked about. Being very clear about rules is really important for teens, especially because, and as we all know this, they act impulsively. Their brains are not finished developing. They don't fully develop until their mid-20s. So right now they act using their temporal lobe to make decisions, which means they act impulsively. The more you can plan ahead scenarios that they might be out, you're going to a party, if you need me, please call me, I'll come get you. Here's what could happen. You can even use me as an excuse. That's a great thing to do for a kid, to give them amnesty and say, tell them your parents are going to kill you if you get messed up. You can't come home messed up. Understanding that they are facing these pressures, but giving them the tools to use those refusal skills. And it really is very, very hard for us as educators and you as parents to teach our children that the decisions they're making now could impact them later. They think that they're indestructible, that nothing's going to happen to them. It's very hard to have somebody stand up there and say, I was your age and I had a few drinks like Ilana, like our daughter, and I tried weed in high school, and I didn't realize that it was hijacking my brain. I didn't realize I was creating this emotional dependence, which then preceded a physical addiction. But that is what we are trying to convey to them. And we are also trying to make it safe for them to come forward and give them the language to ask for help. Again, this is not something for them to shoulder themselves, but it's also not something that they should worry about. And ETL is going to talk about stigma in a minute. But we teach them this is not a moral failing. It's not a character flaw. If somebody uses substances, it doesn't mean they're a bad person, but they are engaged in something dangerous. And you do have to get them the help that they need. And Ilana talks about it now, that she really wishes in high school, those kids that she was friendly with that weren't using substances and knew what she was doing, she wishes they had said something. Now, then she did not want them to say anything, because she really thought she was going to be labeled a bad kid. And she thought that parents would say, don't have anything to do with Ilana Foreman. She's a bad influence. She's a bad kid. Don't go near her. So she was really afraid at that time. But in retrospect, she really wishes somebody had said something. And she actually had somebody she graduated high school with approach her recently and say, you know, I'm really sorry. I wish I had said something back then. And Ilana said, yeah, it's not your fault, but it would have saved me years of misery had somebody spoken up. So we encourage kids to speak up, and we encourage you as parents to learn. And if your kids ask you a question, if you don't know the answer, that's okay. It's something that you can discover together and go on this journey together.
So before we turn over to Q&A, and again, I really do encourage you, get your questions in the chat so that we can have a good open dialogue about whatever is on your mind. I want to spend 2 minutes talking about stigma. I want to pose 3 questions. Question number 1, why does stigma matter? Why do we care that this issue is stigmatized within our community? Number 2, why is there an elevated level of stigma around this issue in our community? And I would argue in all faith-based communities. And then number 3, what can we do about it? So in terms of why stigma matters, I love talking about this research we came across. Dr. Marco Venero was studying rats, and he published his research in 2018. What he did was he put these rats in cages where they had 2 levers in front of them. They would pull on one lever, they would get a hit of a methamphetamine or an opioid. They'd be able to get high and the pleasure associated with that high. If they pulled on the second lever, it would open a door that would enable them to socialize with another rat. So I don't know about you, but my thought is a rat given those choices would probably be hitting the drugs pretty hard. What he found is that over 90% of those rats would choose that second lever to open that door to socialize with another rat, even if it meant going through withdrawal because they had previously had exposure to those drugs so much so that they became dependent on them. So let's think about what that means for us. What that means is that we have people who are suffering from addiction in our community. We talk about addiction as a disease of isolation. We talk about people not being able to, not being accepted by our community, or them not feeling accepted by our community. If we could create opportunities for socialization, if we can embrace people who are suffering within our community and give them a safe space to be able to openly talk about their struggles, they will choose that second lever. They will choose that socialization over the drugs, even if it means they have to go through withdrawal, because we are no different than rats. And so if we can create that type of environment, and that's one of the things we really talk to kids in schools about also, we want to give them, even for those kids who are never going to touch a substance, those goody two-shoes who are never, the rule followers who are never going to touch alcohol, we tell them, it's important for you to understand this too. You need to have the language to understand what your friends are going through. It is inevitable that every child is going to be exposed to someone in their lives who is dealing with substance misuse and addiction. And we want you to have the language to be able to address this and to be able to shatter the stigma around this issue. So why do we have this elevated level of stigma in faith-based communities? And I think a lot of it is that we are very, very demanding of ourselves. We are very, very demanding of our children. We have very high expectations. And anything that we see, that we perceive getting in the way of achievement for our children, we ascribe negative value to. And so when we see someone derailed by the disease of addiction, we immediately say, that's not us. Our kids don't do that. We say that happens to other people. That doesn't happen to us. We're a high achieving, community. And so I guess what I'm saying is we're ignorant, because the reality is addiction, substances don't discriminate on the basis of race, religion, age, socioeconomic status, any of those factors. We are not immune at all from this within our community. So what can we do about it? Well, evenings like this are a great start. Those strategies that Sharon talked to you about, having conversations with your children, got to have those conversations. They're not the easiest conversations to start, but I can tell you, once you're able to start those conversations, they're easier to continue. And you will find that if you can become the trusted source of information for your child, or a trusted source of information for your child, you can create an environment where they feel safe talking about these issues with you. You will dramatically reduce the odds. Can't eliminate them, but dramatically reduce the odds that they will ultimately, unfortunately, have to deal with these issues. So that's my pitch on stigma. We're going to open up to Q&A now, but just an update on Ilana and what she's up to. So after having to interrupt her college education because of her addiction, She finished college online 3 years ago or so. As she puts it, best 8 years of her life. Went on and actually just finished a master's degree in master's in liberal arts at University of Pennsylvania. She's living in Philadelphia. She's currently applying for jobs in labs and PhD programs in public health and communication. She's hoping to make a career out of researching issues around addiction and recovery using her lived experience. And I will tell you, our relationship with her as parents to child has never been better. I got her into running. She and I'm going to go down to Philadelphia in a couple of weeks, and she and I are going to run our second half marathon together. You know, she is a part of the family in a way that, frankly, she never was, even as a teenager. And so I tell you this only because for any of you out there who might have, you know, issues going on with your families, there is always hope. And, you know, we are incredibly proud of what she's accomplished, and we're incredibly proud of her commitment to really use her lived experience to hopefully help other people around this issue. If there is anyone who we can be helpful to, or Ilana can be helpful to, our information is in the chat. Please, please, please do not hesitate to reach out. We're here to be a resource for everyone. With that, we are happy to answer any and all questions. Nothing is off limits. So please, questions about our personal journey, about the things Sharon spoke about, Leanne spoke about, anything that's on your mind on this issue, we're happy to try and answer.
So I'll happily let people absorb a lot of what you shared, because it is powerful, it is strong, it is moving. And as those questions do come out of their mouths, just send it my way and I'll make sure to keep anonymity here. I know it's a sensitive subject that we're talking about, and so I'll just pose the question as my own as opposed to individual, but should they want follow-up, I'll connect you with the presenters. As we were speaking, there's so many things that are jumping out at me, and so I'm going to throw a few of my questions out there as people bring theirs to the table. But the first one that was jumping is, in your story, you recognize that there's an aha moment, right? That you're sitting at dinner and it's been going on for such a long time, and all of a sudden she's like, I have a problem. And as much as you joke about media's influence, which we'll talk about in a second, that feels very cinematic-esque of, you know, I've been doing it in secret for so long and now I just have to confess to my parents. I'd imagine that when that moment happens, you start playing the what if game, right? So what if she had told me 6 months earlier? What if I had no signs? What if, you know, in high school, somebody's parents caught her and told me, right? We go down this rabbit hole. Instead of the rabbit hole, my very poignant question would be, are there signs, right? So using hindsight, not what if, but using hindsight at the situation, did you ever feel like there was a moment that may have clued you into something is going on with my daughter, had I not had all the other factors that you described? Blinders that it doesn't happen in my family, blinders that it doesn't happen in Jewish families, blinders that there's no way she has no access to these, blinders to the fact that statistically there's no way that she's in the 50% of people doing it, right? So looking at, I can't do the math right now, but 10 years ago,
Yeah.
right? A decade and a half ago, when I would imagine statistics were different, Sharon, right? But do you see a world in which there were or could be signs that parents are going to look for beyond the behavioral affect and the physical changes? For your own story, do you feel like there were moments that my high schooler does or is doing something or was doing something?
So ours is a tale of caution, and it is a little bit scary, because when you look at those risk factors versus protective factors, she didn't have the risk factors necessarily, although she was struggling with anxiety, so there's the mental health component. And in terms of the protective factors, she was involved with community. She was a group leader in the synagogue. She was, like Etel said, you know, part of chess team and had captain of her soccer team and had friends. And so on the surface, really poster child, struggled as most teens struggle with fitting in, with self-esteem. The things that I think we missed weren't necessarily clues in her behavior, because she was functioning, she was getting straight A's. There was no slide in grades, there was no behavioral change, there was no, you know, shift of that kind. And honestly, even looking at the admission that took place after her sophomore year in college, her first semester of her junior year, we might not have known, except that she was already failing out of school at that point. So we would have had a concrete, even if she hadn't come and made that admission, and that admission was really on the tail of losing a friend to an overdose and realizing she wasn't going to make it to her 25th birthday if she didn't say something about herself. But I think that the things, it's sort of a reframing of the question, like, what do you regret not doing, or what mistakes did you make? I mean, that's how I always take it, and I'm glad it's being asked. Number one, I only spoke to her once about substances, and it was before she started high school. Even with the drinking episode, again, we thought that was like kind of a normal anxiety of her high school and a very unhealthy coping skill, and sending her to therapy to address her coping skills and to address that anxiety and find other tools was the parenting part of it. But the substance use part of it was, you know, if you're ever in a situation and you lied to me, you told me you're sleeping over your friend's house, but really you're at a party, and either you drank or somebody else drank, or you got high, or you're doing something you shouldn't be doing. I don't care if it's 1 a.m, 3 a.m. I want you to call me, and I'm going to come get you. No questions asked. I want you home, and we'll talk about it in the morning. So Ilana now tells me those words at the end, 6 words, and we'll talk about it in the morning. That was what stopped her from even saying anything to me in the first place, because even though I was saying you're not going to have to pay the piper in the moment, we are going to talk about this. You are going to have to deal with it tomorrow. And the second thing is, I didn't take the opportunity, which I did take with my 3 younger children, to have those organic, ongoing conversations that I'm talking about. I spoke to her once about substances. I laid out the ground rules. You know, we want you to be safe. We want you to be healthy. We don't want you to use substances, but if something happens, just call us. We'll understand. You know, we said the right things, but it should have been more ongoing. And I think the other part of this, and I always say this, is I respected my kids' privacy a little bit too much. I didn't look through the backpack. I didn't go into the room. I didn't, and I'm not talking about snooping, and I'm not talking about micro, you know, managing or, you know, turning it into an FBI investigation. But when my kids needed privacy and closed that door, I took a step back and said, okay, I don't want to bother them. I don't want to interfere. There are ways to get involved with your children, and really, you know, and Sharon is great at this because Sharon models this for me all the time with her 2 boys, having conversations with them and being in their lives and talking to them in a way that encourages them to open up to you in response.
The only thing I want to add, Avi, is that we see this in our support group. Particularly teenagers who are using substances are really, really good at hiding their behaviors. And again, not to scare those of you on the phone, but especially if the use is not yet at the stage where it's getting in the way of their normal everyday functioning, unless you open up that backpack and find the bag of weed, it's often very, very difficult to know. And they're very good at hiding it. And when we talk about, by the way, privacy and all that, we're not advocating necessarily going into your kids' rooms behind their backs. What we're talking about is telling them, saying, hey, yeah, I'm going to go through your backpack. I'm going to do it with you right here. And just explaining to them that, this isn't a lack of trust. This is just something that, it's important in terms of your responsibility as a parent to keep them safe. So I just wanted to make that point. But yeah, it's hard, Avi. I think that she was really good at hiding it. And that put us at a real disadvantage.
So I want to jump on that and segue into the idea of social circles, social pressures, social effects that are clearly had, right? We understand that there's, I don't know the word you used, Sharon, but how if you're doing one, you might be doing another, right? If you have anxiety, you might be having substance abuse, right? I wonder, is there something to be said about the social scene that your daughter or any teenager is engaging with, whether or not it becomes a adversive or protective factor, right? You said her friends, if only the goody two-shoes had said, like what's going on in your life or why are you doing that, versus if I'm always with the bad kids on the other side of the track, then clearly I'm going to become a junkie, right? I'm playing a black and white situation, but could you elaborate a little bit either on the personal or the empirical point of how social pressure, social stigma, and or your peer social group affects substance use?
So I'll start, then I want Sharon's perspective on this, but I think it goes both ways. So, in Ilana's case, she had kind of 2 groups of friends in high school. She had the friends that were her goody two-shoes friends. And then she had the friends who got her right? Who understood the challenges she was having, understood, what she was going through. And again, we found all this out after the fact. And those were the friends she would use with. And so I think it kind of cuts both ways. When somebody has, if a teenager is using substances to self-medicate because there's something going on in their lives that's making them uncomfortable, they are going to gravitate, at least in part of their social life, to other people who have similar challenges and feelings, not because they want company to use the substances, but because they see an affinity with that person in terms of going through a common lived experience. So that's why we talk about understanding if your child is suddenly switching social groups. That is one of the risk factors, right? That's one of the signs that we tell you to look out for, because just the simple fact that there is a change in social groups doesn't always mean that they're using substances, but it's something to investigate and try and understand. Who are these kids that your child is now spending time with? Is there a common theme around those kids that might lead you or give you a hint that there's something going on beyond just, I don't like this group anymore, I like this group now? So yeah, the social circles for them are a real big part of it. And they do tend to gravitate towards each other. Sharon, I don't know what else you want to add on that.
No, 10 out of 10 ETL. It was a perfect response. I think with that, though, when we talk about social circles, right, there are prime times where you see it happening with teens, right? So you're talking about moving from middle school to high school, right? Or when you change a school. So those social settings are happening, right? Those are happening organically when you have that. So it's a good time for parents to have those discussions. Like, I always feel like, when we do a CCSA program, we're like, start the discussion now. Like, you have an opportunity to come. And if your children have seen our programming, then we're able to help you connect the dots to say, hey, I saw a CCSA program. I heard you had one. Or it could be, I just saw a program tonight and I just want to talk to you about it, right? And about how it is, like, about being socially out, right? Being socially out, the pressures around it could be in a party, it could be hanging out with friends for an evening, it could be at a sports game, in the locker rooms, right? There's so many different ways where pressure comes in. And I think it's so important for us to discuss those scenarios out with our children, to say, you might, I'm not saying you're going to, or that you are, or you won't, but we want you to feel comfortable. We want to have this discussion with you that this might happen, or you might get exposed to, and how are we going to deal with it? Or how are you dealing with it, right? We don't know. Our kids might not necessarily, I say, fess up and tell us the truth, but we want them to know that we're able, that they can come and talk to us and that we're not judging them on it, because there's so much pressure, it's so intense being a teenager. I feel so sorry for them nowadays. It's really intense and hard. And we want, and they come home and, we want them to be able to come home and not feel judged at home. Home is a safe place where they come to and they can talk to us and experience, if we can create that environment for our children to come and just share. So it's safe for them.
Beautiful. Okay, we have time for one or two more questions. One that came in that I'm really excited to share is, you mentioned a little bit about these training exercises of like what I can say, how I can respond, so for example, if you said, what, do you know where to get drugs? Or do you know someone who gets drugs? If your teen says yes, right, what would be the next part of that conversation?
Don't panic. Don't freak out, because that's your first thing that's going to happen in your head. I'm going to just tell it to his parents, including myself. And I've been in this world for over 20 years. Don't panic. Don't freak out. Just take a deep breath in and out and say, I'm really happy you told me that. Why don't you share? Very simple. Why don't you share with me a little bit more about that? Right? Without putting any words in their mouth, letting them feel comfortable to just talk about it. Right? Just for them to feel comfortable to share that information. And I think, and it's okay. And that gives you an opportunity to talk about being safe around that, right? So there's like two parts to it, hearing and letting them talk and share that information, but also making sure that they understand the safety part of it.
We have some conversation starters on our website. I can share the page with you, Avi, and you can send it out if you want. But it's really just it's asking open-ended questions and creating that dialogue and then building off of what they're saying. And you also can reflect back to them what they're saying. If I'm hearing you correctly, you're telling me where to get drugs. Let's talk about that. Have you ever been in a situation where you were offered something? What did you do? Are your friends using substances? Are you worried about them? Are there things in your life that are stressing you out? How do you handle that stress? What do you do when you're feeling stressed? Maybe we can talk about some, healthy ways to cope with stress. Everybody feels stress. The big question that has been coming up lately is if a kid asks you, did you ever use drugs? And how do you answer that? And it's not comfortable if you have to say, yeah, I was blown out of my mind during college. I was high, whatever. But you don't have to be graphic and gory about it, but you can talk about, yeah, I struggled too. And, when I struggled, I tried pot, I tried drinking, I smoked cigarettes, not my proudest moment. And, it gives them reassurance that what they're struggling with, the challenges that they're facing growing up and facing their teen years and all that goes along with that, they're not alone, that you did that too, that you're human.
And also that you weren't armed necessarily with the information that you're now arming them with, or that they're armed with around what it means to use. It also gives you a springboard to talk about the differences, as Sharon pointed out, between today's marijuana and the marijuana that
20 years ago,
which is dramatic in terms of its potency. So I think it's that's being authentic with your kids is critical. They can see through it if you're not. They really have good leaders to be able to see through inauthentic conversation.
Beautifully shared. I'd love to keep us going for another 20 minutes. However, though, I'm cognizant of the time. I hope that if people do have more questions and issues, that you have a way in which we can contact you and bring out these questions and continue conversation, because this was riveting for myself and the people watching. And like you said, it's real. It's not going to go away just because we wish it wasn't here. And so I'd like the conversation to continue. I'll turn it back over to Aliza.
Great. Thank you, Sharon, Leanne, and ETL for such an informative evening on how to have these very challenging conversations with our children. This is a really important topic, and we're thankful for the work that you're doing and the opportunity for our community to hear from you tonight. So tonight's program was brought to you by the Day School Initiative in partnership with our Greater Metro West Day Schools Golda Ak Academy, Gottesman RTW Academy, Jewish Educational Center, Joseph Kushner Hebrew Academy, Berea, and Ray Kushner Yeshiva High School. Day School Initiative's mission is to support our day schools in the areas of accessibility, affordability, and academic excellence. We're currently offering grants for new families to our community, as well as for local families making the switch to a Greater Metro West Day School. And as I said at the beginning, for those of you who are here, if you're interested in hearing more about either of those grants, you are more than welcome to reach out. Thank you again for joining us this evening, and have a great night.